school's out, it is spring break, almost. Maybe some this week, some next week. But that means that it's time to make sure your skincare routine is beach ready. Dr. Richard Chaffoo is here to help us. It's always good reminders. My skin is so dry, Dr. Chaffoo.
Yes.
What is going on?
You know what's happening, Shally, right now is it's so dry because our windows are closed. We're turning on the heat. You know, it gets cool in the evenings, and we're drying our skin out. So it's a very common issue. We got to remember, you know, like we've said so many times before, moisturizing and, you know, hydrating to really keep our skin protected.
One of the biggest pieces of advice you always have when you come on the show, and I do it every single day. If I don't do anything, I do this, and that is sunscreen.
Yes. Perfect. Yeah, sunscreen is so important, as you know, and you know, sometimes people think, well, it's a bit cloudy out, I don't really need a sunscreen, the weather's not good, but as we do know, and we've said before, ultraviolet rays will penetrate through clouds or whatever the weather outside. Don't be fooled. Use the sunscreen, something with good UVA and UVB blocking. There are different ones. I like things that are actual physical blockers like titanium dioxide and zinc oxide, because once you put those on, Shally, they work right away.
Okay.
A lot of the others, it takes about 20 minutes before you want to go out in the sun for them to work and get absorbed into our skin.
I am getting ready in a few weeks to take my kids to a spring break, and we are going to be just under the sun. And I think, oh my gosh, how do I put them in the shade? How do you balance all
that's
that?
an important thing. And we have to remember that the peak time of the sun is from 10 in the morning until about 4 in the afternoon.
Well, that's pool time, Dr. Chaffoo.
I know. So if you're going to go in the pool, then you got to remember, you know, use that sunscreen. Make sure it's water resistant. Nothing is really quite waterproof, so to speak.
Okay.
And then if you're exercising a lot, you're sweating, you're coming in and out, reapply that at least every couple of hours. You know, a hat's a great idea to use.
Hat's good, yes.
It's, you know, is for protection. We also want to remember sunglasses, because obviously you can't wear sunscreen on the eye. So this is really, and make sure that when you look for sunglasses, you're looking for, again, that UVA, UVB, that broad spectrum protection.
It's one of the biggest mistakes. If I could go back as like in my youth, I didn't wear sunglasses, and then fast forward many years, I had like teresium popping up, and I just wish I would have taken care of my eyes a little bit better, but I'm doing it with my kids now.
Good.
We know that drinking water is really important.
Yes.
Does drinking a margarita count?
Well,
it's a liquid. It's a liquid,
but there is alcohol in it, so we want to be, you know, a little in moderation, because, you know, alcohol consumption can cause a relative dehydration. So if you're drinking alcohol, you want to maybe, you know, have that bottle of water sitting right next to you, or ice water.
So
you
a
want to
sip,
make sure, right.
Exactly. I mean, let's be real.
Right, we're on vacation.
We're on vacation.
I get that, sure.
Okay, the moisturizer thing, I'm still trying to get a handle on how important it is to
So important, especially like you said, this time of the year, right?
Yes.
Because our skin gets dry. But the important thing to remember is, let's use a moisturizer that is not necessarily too heavy or too thick.
Okay.
Some of those sometimes will trap moisture in the skin, and if it's a really, really hot day, it's going to feel even worse because you're trapping it. So you want that moisturizer, something easy to go into the skin. You don't have to spend a lot of money on moisturizers. Just look for something that's more of a lotion if you're in the summertime, more of a cream if it's the winter time.
Okay, good advice. Indoor tanning, we've talked about it.
Yeah, you know what? Here's the thing. There's no such thing as a safe suntan. So really what a suntan tells us is sun damage. There's been damage to our skin. Our skin knows to release, our melanosomes release melanin, which creates more pigment. So the truth is that when we're doing that, we are damaging our skin. And how do we see that? Age spots, called sunspots, wrinkles, lines, precancerous lesions, and of course, skin cancer. So you can never start early enough. And there are some very good studies, Shally, that have looked at the exposure of sun and sun damage and skin cancers. And we found that if by the age of 35, you've regularly gotten out in the sun, having used sunscreens, you increase your risk for skin cancer 50 to 60%. Some people say, well, what about those tanning beds? Unfortunately, tanning beds, A, are not regulated, B, we probably get more ultraviolet damage. And some studies that came out of Europe, Scandinavia, where obviously the sun's not out a lot, and they have a very fair complexion, they found people that did regular sun tanning had at least an 8 to 9-fold increased incidence of melanoma compared to the rest of the population. So it's a real risk.
It's very easy, friends. So let's just get the words back up there on the screen. There's very good reminders for you as you head now into spring and then the summer. I tell you, Dr. Chaffoo, I don't remember the last time I like lay out by the pool like that. I'm hiding from the sun. When I go out, I'm like, hat, glasses, I don't want to see the sun.
Right.
And you know, that's just stuff that I've learned. So, and thanks to information that you give. So thank you.
Thank you.